Shasha Nazira, and today we are going to talk about something that affects a lot of people in their daily life, which is food allergies and food intolerance. Even though these two terms are often used interchangeably, they are actually quite different, and understanding the difference is really important for our health. So first, let's start with food allergies. A food allergy happens when the immune system overrides to a certain food, thinking it is harmful. This reaction can cause symptoms like swelling of the lips or face, skin rash, itching, or even difficult breathing. In some cases, it can be very serious and may require immediate medical attention. That's why people with food allergies need to be careful about what they eat. On the other hand, food intolerance is more about our digestive system. It happens when the body can't properly digest or break down certain foods. This can lead to uncomfortable symptoms like bloating, stomach pain, gas, or diarrhea. While food intolerance is usually not life-threatening, but it can still make daily life difficult and affect how we feel after eating. So in this presentation, we will explore these two conditions in more detail, looking at their cause, symptoms, and how they impact the digestive system.
There are several types of food that commonly trigger allergic reactions, and these are often referred to as a major food allergens. Examples include peanuts and tree nuts, such as almonds, cashews, and walnuts, which are amongst the most common causes of severe allergic reactions. Shellfish, including prawns, crabs, and lobster, are also well-known allergens, especially in adults. Fish, such as tuna and salmon, as well as egg and milk, frequently causes allergies, particularly in children. Other allergenic food include wheat and soy products, which are widely used in processed food. Even small amount of this food can trigger allergic reaction in sensitive individuals because the allergens are often hidden in packaged food. Individuals with food allergies must be cautious and aware of the ingredient labels to prevent accident exposure.
Hi, my name is Nur Natasha binti Muharram. So I will continue explains the impact of food allergies on the digestive system. Food allergies happen when the immune system reacts to certain foods as if they are dangerous. This reaction doesn't only cause skin or breathing problems, it also affects our digestive system in several ways. So the first impact is diarrhea. When someone with a food allergy eats a trigger food, so the immune system causes inflammation in the intestine. Because of this, the intestines cannot absorb water properly. So the body tries to get rid of the allergens, and this leads to watery stools or diarrhea. So next is abdominal pain and cramping. During an allergy reaction, the body releases chemicals like histamines. This chemical irritates the stomach and intestines. As a result, the muscle in the digestive tract tighten or contract, causing cramping and sharp abdominal pain. This is why allergic reaction often come with stomach discomfort. And another effect is nausea or vomiting. This happens because the body is trying to protect itself. When it recognizes the allergens, it sends signals to the brain to remove the food from the stomach. This makes the person feel nauseous, and sometimes they vomit shortly after eating the allergenic foods. And finally, food allergies can also trigger or worsen GERD, which stands for gastroesophageal reflux disease. Allergic reactions can cause inflammation in the stomach and esophagus. They may also slow down digestion, causing pressure to build out inside the stomach. This pushes stomach acid into the esophagus and creating symptoms like heartburn and acid reflux.
Next, I'm going to talk about how food intolerance can affect our digestive system. One common symptom is gas and bloating. Sometimes undigested food produces gas in the intestines, and that can make your stomach feel really bloated or tight. Another thing that can happen is diarrhea. Certain food can draw water into your intestines, which speeds things up and causes loose stools. You might also experience constipation, where it's hard to pass stools because your body is struggling to digest some foods properly. That can make your tummy feel heavy and uneasy. And last but not least is there's a stomach pain. This can feel like a cramp or sharp edges, usually showing up after eating foods your body can't digest well. So as you can see, food intolerance can make eating uncomfortable and affect your daily life. That's why it's important to know which food trigger this symptom and manage them carefully. Now that we know what food allergies are, let's talk about how to find out if someone has one. So the first method is skin prick test. In this test, tiny drops of common allergens are placed on the skin, usually on the forearm or back. Then the skin is gently pricked so the allergen can enter just under the surface. If someone is allergic, a small red bump or hive will appear at the spot. This reaction usually shows up within 15 to 20 minutes. It's quick and gives a good idea of which food might be causing the allergy. And the next one is the IgE blood test. This test measures the amount of allergen-specific antibodies in the blood. These antibodies, called IgE, are produced by the immune system when it reacts to certain foods. Higher levels of IgE suggest that a person may have a food allergy. So from this both tests help doctors identify potential food allergens so that people can avoid them and manage their allergies safely. Now for food intolerance, the diagnostic methods are a little different. The first method is the elimination diet. This involves removing certain food from the diet for a few weeks to see if symptoms improve. Then, foods are reintroduced one at a time. By carefully watching how the body reacts, doctors can figure out which foods are causing digestive problems. So the second method is the hydrogen braid test, which is often used for a lactose or fructose intolerance. So after drinking a solution containing the suspected sugar, the patient breathes into a device that measures hydrogen in the breath. High hydrogen levels means the sugar wasn't digested properly and was fermented by gut bacteria, indicating an intolerance. So together, these methods help people identify the food that triggers symptoms and manage their diet to stay comfortable and healthy.
Effective dietary management is essential for individuals with food allergies and food intolerance. For food allergies, complete avoidance of the allergenic food is necessary, as even small amount can trigger severe reactions. Individuals are advised to read food label carefully and be cautious when eating outside the home. In some cases, carrying emergency medication such as an epinephrine auto-injector is required. For food intolerance, management usually involves limiting or reducing the intake of trigger food rather than total avoidance. Enzyme supplements such as lactase tablets may help improve digestion. Substituting problematic food with suitable alternative can help maintain balanced nutrients. Proper dietary planning is especially important to prevent nutrient deficiencies and ensure long-term health.
So I will talk about the possible complications of food allergies. The first complication is asthma. Food allergies can make asthma symptoms worse because the immune reaction releases chemicals that tighten the airways. This can cause coughing, wheezing, or difficulty breathing, especially in people who already have asthma. Next is complication oral allergy syndrome, or OAS. This happens when someone eats certain fruits, vegetables, or nuts and experiences itching or mild swelling in the mouth or throat. This occurs because the proteins in these foods are similar to pollen, so the immune systems get confused and reacts. Food allergies can also have a psychological impact. People with allergies often worry about eating outside, trying new food, or accidentally consuming something dangerous. This way can cause stress, anxiety, or embarrassment, especially for children who feel different from others. And another complication is chronic eczema. When a person with eczema eats a food that triggers the allergy, the immune system becomes more active and increase inflammation in the body. This can cause long-lasting flare-ups, leading to dry, itchy, and irritated skin.
In conclusion, food allergies and food intolerance are common conditions that can significantly affect the digestive system and overall health. Food allergies involve an immune response and can be life-threatening, while food intolerance are caused by digestive difficulties and are usually less severe. Despite their difference, both conditions require accurate diagnosis and appropriate dietary management to prevent symptoms and complications. With proper awareness, medical guidance, and lifestyle adjustments, individuals with food allergies and food intolerance can effectively manage their condition and maintain a healthy and balanced lifestyle.